We have lost many people because of war. Then even COVID-19, it's like a war to refugees and all people. I'm sorry to say that refugees, as you know, they are really people who doesn't have anything in this country because we left our countries, we came here because of war. Then we don't have houses, we don't have farms, we don't have anything to get something from. Is to work day to day to get something to eat. Our child, we must also go to school. I'm going to talk about, my second point is COVID-19 brought refugees back to zero completely. To zero because we don't have where to start. That even food is hard to get. This is have to force a number of decisions taken by the young girls that have resort into teenagers, pregnancy, prostitution, among others, to see how they can bring food on table. Young women, single mothers, and also men who doesn't have work. You know what I'm talking, imagine. I know even Ugandan, they are passed through challenges, but at least they have something behind. They are, I have a land at village, let me rush to village. But where to go? We don't have anywhere to go. It's to stay. It makes us as parents to be rude to our children. Sometimes you beat them to sleep because you don't have anything to give them to eat. You don't have even water because water is money here. Everyone knows. To get a jerrycan of water is 500. You are not working. How do you going to get that water when you don't have that coin? I'm going to talk about education for our children. That day we took our children back. We have them who has to go to high schools like senior 5, senior 6. You know how you start, you are starting new school when you are in senior 5. May I have 2 of them, for example. That time I took them back. They had just remained 2 weeks, and I paid everything. Uniform, fees, and everything. It's a million and millions. That is what I say. To study here is expensive, a bit. I was giving that man out, and children, they are just 2 weeks to 3 weeks. Then I get a call, come and pick your children, without prepare myself. How do you think? I lost that money? That is what I can say. I lost money. Even my children, they are lost encouragement. When they come back home, they was like, Mama, we are finished. How are we going to do in that situation? I have 2 daughters. It was terrible to me to handle them. And I don't know what to say in front of them. They are there. I have boys also. They are 15, 18, 19. I was like crazy woman in front of them because I don't know what to do for them. I don't know what to tell them exactly. But we thank, because I thank God why I'm in front of you guys, people. I'm still alive with my family. That is what I can say. And my family, I have one old woman. You know, when people becoming old, Their needs are many, a lot. She has pressure, she has diabetes. We need medical, but we are in lockdown. I myself, I'm thick. I'm not did okay with my back and everything. I can't give Dr. Chris or the office, they are not my issues. But I must go to village to look for where I can dig, then they can give me a basket of Irish or potato to give my children. How am I going to dig with this bag? I can't sit for 50 minutes. It's hard to me. Why you see me walking every time out. On behalf of refugees, what I think they are in a hard situation. But what I called our people, our organization, our government, to see how they can look for refugees where they are. Because really they are in hard situation, they're in hard time for them and their children. Because at least we have to say when they're at school, we keep them at school and then you see what to do. But now they're at home. And we don't know when the schools they will be open. They are open some cadet classes only. What about others who are behind? I'm talking about security. Also, in security, we have hard time because when we got a problem, we was rushing to Refugee Law Project. But now it's hard, it's limit to move to Refugee Law Project to get access, to get what we can again from there. It's hard because you must make appointment. Also, the workers are not there all as you see situation are. Our people being caught from the Lord and being on jail, many of them. Others have died. Our people died in that situation we are in. Now, I'm asking who is going to stand with us? Please, I'm asking, I need your response to be with us, behind us, because we lost our people where we came from. Now we are thinking also to lost them here in this country where we hide ourselves. We need our helps. You all who are seated here at the organization, we talk to them. Please help us to look for us, to think what you can do for refugees, especially women, single mama. There are many, they are suffering with their children. They don't have anything to do. Even the business where I was doing, I have some, for example, there are on my table books. I was making clothes, bitenge, but I can't move freely like before to see how I can get a coin to give my children, to give my family. I have orphans. I think others also there like me.
Thank you, Jolie. It's okay.
My sister.
Thank you so much. You can have a seat as you psychosocial health. This is when we need support. It is okay. Okay, just one more point, and then you can be able to.
When my sister Mary was addressing has program she has. She touched my heart because what I was all thinking in my head, she tried to address for people why I'm not getting what to say, because a lot she talks about it. And I think Refugee Law Project, what am I? I was a person who is in depression a lot. And I have daughter who is anxiety disease. Now, she talks about me a lot. I was thinking she talks about me because what she said, it's all me with my family. I thank Refugee Law Project for what he did before. In COVID, he helps us with something. UNHCR also, he tried to help refugees, but it's little. We need to see how they can increase. When we think about rent, children, it can't be enough. Thank you.
Yes, thank you so much. Thank you. I guess we can now have a feel of how important psychosocial support is. As we're thinking about legal issues, as we're thinking about EFA, think about the psychosocial well-being of a parent who has lost literally everything, has come trying to survive, and as soon as you start something, everything goes amiss again. Think about, as you're listening to other speakers, think about that. And as she has cried out, what can we do? How can we come in to assist? Because we are looking at the plight of urban refugees. We are looking at how they're trying to cope despite it all, despite what they went through, despite the fact that they come back to the same. How are they trying? How can we come in as different entities? How are we coming in to be able to give support? Thank you so much, Jolie, for that. And on that note, before I go to Salongo, I think this is the opportunity for us to know who are urban refugees. Someone has given an experience, but then we need to know who are these people. Are they people only are they only people only in Kampala, or we can find them in other places? And if it's Kampala, why so? We are looking at a country that has over 1.4 million refugees. We are looking at a country with the best refugee policies. We are looking at a country that has 85,000 urban refugees. Are they the only urban refugees actually? OPM. We need to understand this. People in Arua, people in Hoima, do they qualify to be urban refugees? And if they don't qualify, why don't they qualify? Why do you choose Kampala? Mbara is a city. Arua is a city. Why don't you think about them as well? Yes.
Wow. Thank you so much. My sister, I can feel you. I heard you, and I listened to every word. Most of us have been in this business for a number of years. When I look around, there are people who have been with us 10 years and plus. Every time and again, we meet and share these experiences. It is not a new experience from a refugee, but this is also a unique experience because we normally get these stories from refugee settlements, but this is now another story of an urban caseload that is representing maybe a bigger number out there. I wanted to start on that note to tell you that feel at home. You may be having challenges, but in Uganda you have a home. And that is the entry point number one. as much as we have challenges in management and protection, but the first thing is to have a home. And when you left your country, at least you got a home in Uganda. We must appreciate that, and then we go into the details. I am also aware that the life patterns are not the same. Even back home, some of the expatriates we have from other countries, not even refugees, Dr. Chris and the team, you can agree with me that when you reached in Uganda your first time, you had a few challenges here and there to cope up. And that's why we encourage all our humanitarian actors to have coping mechanisms as a tool of how we can talk to the persons of concern for survival and sustainability purposes. So I can feel you loud and clear. Putting that aside, we can't work outside the law. For any country to survive, the rule of law must thrive. What does the policy say as of now? The Ugandan policy in practice is that we are operating a settlement policy. The Republic of Uganda is operating a settlement policy, and this settlement policy says there are gazetted places where we can have these refugees staying with host communities in a more integrated way. That's why most of our institutions are integrated. Let us have same schools, let us have same hospitals, let us use the same markets, let us eat, let us go to same public places. And I think that is where we get a credit. But again, the assumption was that everybody will go to a settlement. But now this story tells us that not everybody actually is willing to be in rural setup. There are those, either from time they were born, they have been staying in urban dwellers, and maybe coping up with life in a rural setup may be very difficult. And at that time, when we initiated the debate, most people were rushing to Kampala. We must also put into consideration that rural-urban migration is a global phenomenon. Even as nationals, I have seen my brothers, I have seen my sisters rushing from villages to Kampala, with or without a job. I say, I am going to the city. How to survive, God knows. Up to date. And that's how most of the cities globally have developed slums, have developed street kids, have developed all these types of people. So rural-urban migration is a global issue, and I think Uganda is not exceptional. I'm trying to play this background so that we understand deeply the issue of urban refugee caseload. And I think when we were overwhelmed by numbers in Kampala, because at first they were not registered. You would be registered in a settlement, and our laws allow you to move from one place to another, as long as you don't go to the border point of your country because of your protection and your security. But you can move to any other place, you can go and do some work, you can go and study, and many people started coming to Kampala. Now, we again got a wave of now refugees who are not coming from neighboring countries, from very far, who would come by air, people from Somalia, we got some people from Iraq at some point, people from Eritrea, people from Ethiopia, and there was a need also to look at what they were doing in Kampala. The simple studies showed that actually the majority were doing business. That's why they were rushing to this town to do business, to look for alternative form of livelihood. And that was a plus to us. I said, why can't we recognize these people now? In form of registration, in form of documentation. But again, how do we provide a service to people in this city where everybody is struggling for this service? For example, if you chose to distribute food, how would you manage? You have people who came here to look for jobs. They did not have intention of seeking asylum, But when they fail, they turn into asylum seekers. The country suffered that. You are a Pakistanis, you came here, and when your work permit expired, you have no choice but you say, today, I am asylum seeker. So there was a conflict of the law between now the Refugee Management Unit, now the migration, and other arms of government. Said, okay, we can work toward this in a more integrated approach. Partners have helped us. And I know Refugee Law Project, you have done a lot of studies on this thing of urban caseload. Now, recognizing Kampala refugees as urban by registration and having documentation. Where they stay, what they do, what they eat, the assumption was these are people who moved to the cities because they can fend for themselves. As I said from the beginning, COVID-19 is proving to us that actually not everybody in urban is doing very well. Not everybody in urban is doing business. Not everybody in urban is engaged in a gainful employment. The results are showing. But what have we done? Because that should be, again, a question posed to us as a department. If you have seen that gap, what are you doing? The immediate solution to that problem is, please, can we create a referral pathway that if you can't manage urban anymore, we have space in the settlement. Mama is crying of where to dig, is crying of where to get water, is crying of... Now, the community services sector of OPM, UNHCR, and all our partners, they handle. These are case management issues. Engage them. I can't manage Kampala anymore. I had my business was frustrated by COVID-19. For me, I can't even afford paying rent. Solution? Okay, we have space in settlement X, we have space in settlement Y, we have space in settlement T. Can you go where you can at least get this monthly food ratio for your survival, for your children? The health centers are near, the education institutions are near, and maybe in case you readjust your life and get capital, you can come back to Kampala. Some have listened to that message. And as I talk right now, actually what I did not talk about in the morning, that the referrals have started. The refugee leaders who are here, they can testify. And the commandants, I think, you've been receiving people now from Kampala to the settlement, because some have actually said we can't manage anymore. So we created that window to solve this problem, the referrals. As much as we are referring people from Kampala to the settlement, we get, again, other requests now. The commandants are overwhelmed by refugees who are saying, actually, give me a movement permit, I'm going to Kampala to do business. So as you send people back to the settlement, there are those who are still interested in coming to the city. That's the scenario. And I think when we have these debates, as actors, we need all to put our heads together and get ideas. When we are reviewing, coming up with our refugee policy, a lot of consultative meetings were held. I think the chief of MADI, you were part of the team that were consulted in Ajumani about the refugee policy. I am also reliably informed some colleagues from from Refugee Law Project were part of these consultative meetings. We wanted all these ideas to have them in a working document. And unfortunately, we can't discuss the refugee policy now. It is under cabinet, but it is a very good document which has catered for most of these good ideas, including the urban caseload. So once the cabinet has approved this, then we are good to go and see how we can make relevant interventions. What do we do with the rest of the groups which are not in Kampala, but they are in other urban centers of the Republic of Uganda? We have talked to our refugees different times that we all have homes. But from that home, you can move, go to a certain place, Y, X, and work and come back. Ladies and gentlemen, I am not born in Kampala. My home is not in Kampala. I am born from Kamwenge district. I went to Mbara to look for work. I worked for some time, but I would time and again go home. I am in Kampala now. In most of my weekends, I have to go home. We've been telling refugees, for you leaving a settlement, Mvepi, Rhino Camp, and go to Arua to work, but you have a home. Your plot, your land, your racial, your everything, your home is in that settlement. You can always refer to that. Most of the Somalis had that message. As I talk right now, most people actually, Somalis you see in Kenya doing business, they are home in Nakivale. They get their ratios. They have relatives. The second rotary who pick even their food on their behalf. So I think sensitization and talking to ourselves so that we can solve this problem together. It's not a one-man business. We need to convey messages. And of course, this explanation may not satisfy everybody. Absolutely. You may find now Mama is in Kampala because of reason why, and we need to understand the reason. So I beg our community services, I beg our protection team, and I beg commandants who are here to take interest in some of these good ideas. They will help us to improve. But that's what the government is doing. We are not seated. And can I tell you one thing? It is not only Uganda that is grappling with the issue of urban refugees. It's not. We have challenges. I have been at international fora. I've seen countries crying. And some countries, for security reasons, they have made up their mind and say, please, we must have these people out of the city center. But Uganda, we've not done that because we know refugees are part of us. Our rules are very clear. We are working together. In Kenya, the issue came up with security after the bombings and said, no, this insecurity is caused by refugees from Dadaab, and we must close Dadaab. And you know, a lot of theories, a lot of stories have come up until when UNHCR engaged government, and that's how Dadaab survived closure. So these issues are for real. Mama, I pick you well, and I think we need to have you one-on-one, pick interest, get contacts. Let us understand we can get more ideas on how such categories of people can be assisted. But on a bigger picture, that's what we are doing. Those who can't manage the city, there's a window that you can get back to the settlement. As I talk right now, many families are being referred. And you don't even now, we don't say get a bus. The transport and everything is arranged for you through UNHCR and the ARD. Yeah, they arrange and take you with your family in the event that you can't manage life anymore in Kampala. The discussion can go on, but I know we are time bad. I'm here with the team. We can answer any question. I think we allow the colleagues to first present so that we get a bigger picture of how they feel. Then we can come in at an opportune time. I want to thank you so much for bringing in refugees to give us these insights so that we have a takeaway. On the last note, that even in Kampala, we made an attempt at the start of COVID, the lockdown. Partners came and said we've mobilized resources. And that's when government was now giving some few supplies to nationals, and the condition was to have a national ID. And then the refugees, of course, have different types of IDs. So partners came and said, can we give something? As government, we never stopped. We said, okay, if some resources have been availed, let us discuss a way of how these resources can be extended. That's how you saw WFP coming up. That's how you saw UNHCR coming up, teaming up with partners, international government, giving out some of these few things. And as she rightly said, some of them could not have even reached others. Because as we talk Kampala, the other colleagues are in Mukono, the other are in Jinja. So it is, you can't overstretch yourself that far. We have to get a very comprehensive approach to this issue of urban refugees. We have engaged KCCA in our response plans to see how this big number of refugees in Kampala can be catered for. We have an MOU, a very good standing MOU with KCCA about some of these institutions, including schools, including health facilities. And I know Refugee Law Project extension workers, you must have been meeting some of these refugees in some of these institutions, but I entirely agree that our response in urban has not been the best because of our policy, which is actually the settlement policy. It is a new thing, it is eating us, we have to put our heads together. And those who are doing research and other studies, those who are mobilizing resources, you need to come up and support the government. I've taken some few minutes, but I thought I would do so in order to bring out the background on how we are managing. Thank you.
Thank you so much, Mr. Biaruhanga. First, I need to acknowledge the fact that it is clear from your presentation that whether you're in Hoima, or you're in Bara, or you're in Arua, you are self-settled. You are not urban. Should I conclude that?
You leave your settlement, you go for anything, whether it is work, whether it is business, your home is in the settlement where you are registered. That is your home. I have a home, she has a home, you have a home. Our refugee homes are refugee settlements. Those registered in Kampala, the assumption has been you can fend for yourselves. But again, with this new innovation, that you can't, a window for you to get a home is also there. Even those who are not yet registered in the settlement, you are in Kampala, you want to go to the settlement, you will get a home in any settlement that will be available to you.
Thank you so much for that clear explanation. On that note, I would like Mr. Salongo, having decided that he won't manage life in the settlement, he can't be able to look after himself in the urban area. I would like him to explain to us, to tell us deeply how he has been able to manage the glaring truth, the raw truth of what it actually means to be in the urban area. Or he can also take the option or the window of going back to the settlement and going back home, actually.
Thank you very much. Allow me to stand. Dear ladies and gentlemen, good afternoon again. As introduced, my name is Amadou Salongo Jean-Pierre from the TRC, living in Kampala since December 2012. I am a member of Rendezvous Youth Group, which is a Refugee Law Project support group. And in that department, in that group, I'm in charge of podcasts. I thank you very much, Mr. Biaruhanga, and everyone who presented earlier. A lot of things have been noted, and actually, many questions have also come up. I'm wondering if we will get answers. Okay, it's true that we are talking about forced migrants. These are not only refugees, asylum seekers also among them, but also those ones who have not yet been registered. They have entered in the country, they're not registered. They have been forced also to migrate. So I would like also them to be included. When we talk about urban settings, yes, a few of us have got to know what it means to be an urban refugee. And we thought we could cope up with the situation. But I guess for every special event, there is a special way of handling it. So we have been trying to handle the situation. We have been trying to cope up with the setting of the urban, but COVID-19 has come unexpectedly and everything has been turned down. And from here, I would request first the Office of Prime Minister not to always focus, and even other organizations, not to focus on the urban policy, but also look at it into another angle. Yes, it has been proven that there is a mechanism of going back to the settlement. Yes, it's very good. Actually, we have been encouraging people as leaders on to go there, but it's not a permanent solution. I guess, as I've heard in many sessions, the Ugandan government and the other different stakeholders are preparing for how they can get stimulus package for Ugandans in businesses and other things to cope up. Maybe it should be also be thought about in the refugee world. Okay, coming back to my point is like, we have one thing, the assumptions. When we talk about a forced migrant or a refugee, when you go elsewhere, they say these people are here, the government is giving them money. We hear this in taxis even when we get in taxis. But refugee, we are sent as UN is catering for them. So those are things people think, but maybe which are not true. They don't know how we are struggling. But we thank the Office of the Prime Minister, we thank the government of Uganda for this setup they have put up to say we can get services in the same hospitals, we can go to the same courts of law, we can go to the same schools, it's really good. And it has been working not so much well, but pretty well. And we are grateful for that. Now, as COVID-19 came in, it did not find us very well, as I said, but we have been trying to cope. Why? Because first, in the way of work, we did not get to our knees and work like other like Ugandans. First, it's because of our academic background. I am personally from the GRC, with a diploma in general education, general pedagogy, that is education. Then also I was in the third year doing medical laboratory technology. I guess going in a hospital here, when it comes to English, I cannot do it as it is in this setting here. So I will find myself in the French part, and it's quite difficult. That's why even I opted to go in other fields, not even medical. But also there is unemployment. Also among Ugandans, there are also many Ugandans who are not employed. So I guess I tried to engage Mr. Innocent. Somewhere we had an online discussion. It was a Twitter discussion, and I asked about that. Then they said they cannot give that so much opportunity to refugees when Ugandans are not employed, because it can create conflicts, which I understand. It can create somehow a conflict, but I'm happy that some organizations like Refugee Law Project give an opportunity to refugees and they can get a living through that. Thank you, Director, for that option. Then we have language barrier, which is also one of the issues that has caused us not to work. We have cultural differences, and then we have the myths, the mindsets. You go to apply for a job, and just because you don't speak Luganda or any Ugandan language, they say you are an investor, or you're an investor. So they don't know who is a refugee, actually. How did you come to Uganda? I think you are just trying to mock them. You are not, as you are claiming. So when COVID-19 came in town, we have found out that employment wasn't there. So refugees had gotten their ways to cope with the mechanism, to cope with life. And one of them is actually hawking. And all of us, we are aware with the hawking policy, actually with KCCA Acts. You cannot hawk in Kampala. And if you're caught, you'll be tried in courts of law, and you risk to be imprisoned. Now, refugees had to get another mechanism of going out of Kampala. This involves movement. And some of these people maybe are single ladies who are looking after children. Going outside Kampala was at that time easy, because they would wake up at 5, prepare children, then as they're going to school also them go, then they come back in the evening, maybe at 10. With a curfew, they can no longer come late, and they cannot wake up very early. So that's another problem. With children being out of school, you have nowhere to leave them. They were supposed to go to school so that also you can go and find how they will live. You cannot do that anymore. With transportation, the reduction on the number of people going in a taxi, the transport has gone high. So interest becomes a problem also. You cannot go there. Then customers. We know that refugees, especially like refugees, normally deal in bitenge and jewelries. This is cosmetic. It's beauty. And with COVID-19, everyone's financials were affected. So people focus on the basic. It means food and medicine. So this lady who is going to hawk bitenge and jewelry, is she going to get someone to buy? It's another problem. We have also a problem of stigma and discrimination. When someone goes, let's say in Gulu, to sell, and the language they're speaking is not of the locals, is expected to have come from another country, and maybe that person is the carrier of COVID-19. So it becomes also a challenge. That means you cannot go out of Kampala. So what has become a problem? Refugees have been locked in Kampala, and the jewelries they had in Bitenge were forced to be exchanged with food to the neighbors, and now they have no capital. The government has opened school for candidates, and we don't exclude refugees. They have also candidates. So they have to go back to school. There is no coin. They have nothing to eat, and there is no capital. So don't we think maybe if something is gotten for them, they get a startup capital, maybe they can do something else. When it comes to the food distribution, yes, we happened to get some chances when food distribution took place. Yes, government was focusing on on nationals, and as you said, they could say refugees are supposed to be in the camp, and I hope all of us saw it even on NBS. In Kisenyi, they said, no, it's for nationals. You are supposed to be in the camp, your food is there. And it wasn't true, because some have been allowed to stay in Kampala. And as you have said, those ladies who are staying in Kisenyi from Nakivale were not able to go there because transport was down. So now, what was the option? It is to borrow. Who does a refugee borrow from? A national has somewhere they can borrow from the bank, from friends, maybe who have their money. Does a refugee have a family to borrow from? So how could they survive? It's another problem. Then, when it comes to protection, we had challenges. During all these challenges, refugees still had to survive. So they had to engage in activities that maybe could be illegal. That means hawking within Kampala. And many people were arrested. At that time, offices had closed, Refugee Law Project, they were at home, UNCR were at home. Every office was locked. I cannot go at home because my home is where those people are. So they are arresting her, and the daughter is coming to me, Salongo, my mom is in. We don't know where she was taken. She was just bungled up. I will go to CPS. After CPS, I go to every police station, checking pictures. These are the people we have arrested. See if yours is here. Then you have gotten the person is maybe in a certain prison. It has been caught on Friday. Then on Saturday, you have discovered you don't know where the person is. So you have to start again, to go on Monday, to go to the court registrar to know this person was tried and was taken where. Is it Chigo? Is it? You don't know where they were taken. So you have to find out. After that, you have to find out when will they be tried in court. Did they get legal assistance? Did they get an interpreter? You find all that was not there. So how do we do that? Myself, I was going like that, either on foot or I get a bicycle. You can imagine running up and down a bicycle the whole day from CPS to City Hall, then to Chigo. You know where Chigo is? So some people know how I suffered. I chopped all the weight. In just 1 week, my mother was scared. I didn't want her to see me because I had to do it, but it was difficult. When it comes to health, many people thought when COVID came, all diseases ran away. They focused on COVID-19. Talked about wash your hands, wear your mask, keep social distance. They didn't say take your prednisolone, take your Coartem, take other things. Yet, all those things continued to exist. Those who are HIV positive remained positive. Those who had hypertension remained like that. Those who had diabetes remained like that. Malaria continued to attack people. And many people got affected, but transportation from where they use to where they stay and where they're supposed to get treatment from was a big challenge. If I can bring in just an example of one lady called Mama Yeye, who happened to die after 3 admissions in 3 weeks. It was tricky. She will fall sick, you call here, this office and the other one, nothing. You go, sometimes I could get actually an ambulance from government hospitals. They would give you an ambulance, someone is taken to Chirudu. After 2 days, she's somehow stable, go back with her at home. Where is morphine? We don't have. Please try to look for it. You ride a bicycle for 3 days looking for it. By the time you get it, because you not sleep, she's calling. The whole night, as she's in pain, she cannot sleep, so she will keep calling you. My son, I'm dying. My son, my son, my son. And you find that there is no office that you call at that night, but you can call your son, of course, because for us, we are their sons. We're in the community. We have our numbers. So it was pretty challenging, and she happened to die and left many children. All of them were minors, and only one was above 18, and she wasn't registered. She had just crossed. She was not yet registered. Burial was a challenge. Imagine at home, go first to Chirudu, get clearance, then come with a bicycle, get also clearance from City Mortuary. After there, ride the bicycle to Nambole, start requesting them to prepare where she'll be buried, then get transport. They will tell you the transport will be there, and until you see it is 3, 4, there is no transport. You look among friends, you get some money, go to burial, and then you are finishing burial at 7 p.m. Police is with you. It's curfew time. It was quite challenging, but also traumatizing. You can imagine all that situation. You cannot go away from it because you are in the community, and that is not evitable. Medicine, I can acknowledge some officers tried their best to give drugs, like JRS, of course. They gave a lot of medicine, not all of it, but a lot. They did some tests, not all of it, but some. I had tried. When it came to food, they came in for sure. Refugee Law Project gave some money to groups. GRS gave food. Yarid gave food, PPDR, and many churches. They tried their best, but it was not enough. Because we know as funds are limited, it was expected that we could not get enough. Education, I've said, many people have failed to go back to school because of the IGAs of their parents or their caretakers have failed because they have eaten the capital. After all, this did not just go like that. Many refugees have become creative, and they tried to cope with the situation. And yes, and they came up with some innovativeness. We can say refugees became more united than ever. Refugees have come together, they try to connect with each other because I could not be here and do what is the other side, but I had only to communicate with them and know, can you do this? Where are you? Who knows what? Who can do what? And that was important to us. And then innovativeness, as I say now, there are many refugees who are doing some things and they turned to do others. Myself, I was a language interpreter, and that's why I was relying. But seeing the gap which was there, I had to shift. Using the skills I got through Refugee Law Project and our Media for Social Change program, I acquired some skill in basic video advocacy. I had now to sit on a camera, put a story down. If the person doesn't consent to put it out as they say and as their email with their image and their voice, can we act? Myself, I'm an actor, and we had to act it, but also with evidence. We had to come up with, we had started with the podcasts. We had to use that way to bring out the voices of people who are crying so that at least someone can hear what they're doing. And I think this, like the podcasts are on the Refugee Law Project's website, but also the YouTube channel of Rendezvous Youth Group. You can get them there. Like one which talks about how women got engaged in sexual activities to take care of their people. There is one short film called It's Not By Choice. You'll find it there, and it's quite, you cry when you watch it because it is very small, very short, but it talks a lot. During this period also, many refugees tried doing other new things. Like there is one we are going to document on Friday. She's called Mirei Kitenge. She was a fashion designer. But when COVID-19 came, she could not sell again in her activities. She had to shift to something which could help her community, but also help herself and something. And she started the soap making, which has earned her something. It's not her alone. There are many, only the time is not enough. I can go on with that. Peer counseling. Many people have been relying on officers, but it was the time now. People had now to do it also for themselves. They had now to do a one-on-one because you are a neighbor with someone. At least you can tell them something. You cannot wait for the office. Of course, officers came up with mechanisms like telecounseling, which worked, but it came somehow after some time. And they did it because they understood that there is a gap. But that gap had to be filled at a certain time. There was a problem with the package of information. Everything that came through media was so scary. And with our past, it was just adding salt in the wound. just a little bit and you go down. You feel people dying in Italy, 800 people in a day, you say, oh, we are done. Here we don't have any medical health system, so we are gone. Thank you. Now, when it comes to this, I cannot go without talking about closure of churches. Churches have a very big role, and mosques, in countering fear and also building hope, because this is where they tell us and we say only amen, but these places were closed. So they had to go online, and refugees don't have data and others don't have smartphones. Do you think they could access these services? They couldn't. So it was a gap also created. Asylum seeker registration, as we have said, some people were already in Kampala and they were preparing to go to the centers to be registered, but they were stopped by COVID right in Kampala. Mr. Byaruhanga, maybe for, again, some information, we have a lady who came and she was pregnant by that time. She gave birth during that period. She was not registered. So we were scared, if she gets complication, what are we going to do? If she dies, how do we get a burial permit? So it was really complex. And her sister, who was 19 years, got to be arrested when she was trying to get food for her. She was detained in Chigo for 2 weeks. That process, I had to come to work as an interpreter, then to work as I will not say a lawyer, but also trying to explain what happened, why she doesn't have documents. But also I will try to thank the government of Uganda, because the police was cooperative. I would acknowledge them. They were very cooperative. And whenever we needed their support, they did. When we went to court, they did not give us so much headache. They could listen, and then they say, okay, let's do this, but next time, please, don't do this. And then we got, eventually she's out, but she's not registered up to this time. But she has her auntie who is in Kampala, who has nothing. When you say they can go to the camp, I'm wondering, do you give them transport maybe? We bring them at OPM, then they are taken to the camp for registration, but they can come back, because as they are, they cannot live on their own. This auntie can get for them something to eat, but she doesn't have money to take them and bring them back. Can they go register and come back to Kampala, where they can get someone to support them also emotionally? Because they don't have a mother, not a father. This one has just given birth. She's 17. She needs someone to help her mentally. And this one is like her mother. Is it possible? I think if we look into this, it will be very important. Thank you very much.
Thank you very much. I think some of us watch Bukede TV, and there's what they call Gatali Konfufu. Like, what you have just experienced is Gatali Konfufu, live at Protea Hotel. Because he has ably explained exactly what the pandemic brought to play, how they're able to maneuver, how they're able to survive. Some went into legal business, they had to find means of making sure they go through this. Of course, I can't commend the illegality in this, but I think people are pushed against the wall. And we as stakeholders, this is the opportunity for us to be able to step in. Such illegalities can be avoided. And he has also elaborated on, the way forward, how they're able to unite. I think that's the positivity. In as much as we're looking at the negative, I think it was good for him to bring out the positivity in all this. They were able to unite. They were able to adapt to change. They carried out different activities to adapt to change. I think that is very commendable. Mr. Salongo, thank you very, very much. Yes, so on this note, I would like to hear from our representative from JRS. Mr. Salongo has mentioned that they came in to assist, they came in to help. Mr. Geoffrey, I want you to tell us, how were you able to come in to assist the refugees, the urban refugees? How were you able to, how were you able to adapt to the changes? Because I know you weren't doing business as usual. So how were you able to come in to help with livelihood, to bring self-reliance, to bring resilience to the refugees. I need you to elaborate to us so that we understand. I'm still grappling with the idea. How are you able to do it?
So good afternoon, everyone. Yeah, so I would like maybe we stand up a bit just to stretch. We have sat for too long. Okay, if you can, please. If you cannot, it's still fine. Yeah, but it's nice to stretch a bit, just to relax. 1 minute for that, and then we resume our normal business. I can see Dr. Chris has done it very well. You can resume your seats. Thank you. Yeah. You can also show off as well. Everyone had the opportunity. Yeah. Okay, let's resume our seats. So I'll start by introducing myself. My name is right there. In case you cannot read it, especially for those behind, my name is Godfrey Ogena, and I work with the Jesuit Refugee Service, Kampala. Jesuit Refugee Service is one of the partners that has been working with urban refugees since 1998. So that is a brief of the background. If you want to know more, you can just approach me or go online. All the information is there. So I want to, first of all, thank the organizers of this meeting. Yeah, I thank everyone who has put their hands together to make this a success. So thank you. So going right away to what I've been told to do, my presentation is going to focus on livelihoods, resilience building, and self-reliance for urban refugees in COVID-19 pandemic times. That is what I'm going to do here. Okay. So starting with, it's important to understand what these basic words are, because if we don't understand it in very simple terms, then we miss the point. So I want to go to livelihoods. Basically, when we are talking about urban refugee livelihoods or livelihoods anywhere, it's just about the ability to secure the basic necessities of life. All right, yeah. So in very simple terms, that is what it means. And then how about resilience building? So when we talk of resilience, we are simply looking at the ability to recover from adversity, shocks, and all changes or adjustments. So for example, COVID was a shocker, and therefore, when we talk of resilience building, we are trying to look at how were the refugees able to adjust to those shocks or the shock that was brought about by COVID-19. Self-reliance simply means depending on your own resources to meet your own needs. That is what self-reliance is about. And then, of course, there's been this discussion about who constitutes an urban refugee. So I think we have heard from my namesake, Godfrey. So it seems still the understanding of who is an urban refugee. People understand it differently. We don't have that universal definition, so it depends on a number of things, the legal framework. So for the purpose of this presentation, I'm simply going to focus on what is provided in the framework of the law. So when I'm talking about urban refugees, I'm focusing on Kampala for the purpose of this presentation. I know there are urban refugees in other settlements, other districts, like Arua, in Jinja, in Mbale, but I will limit myself to Kampala because that is the experience I have. Yeah, and then COVID, why is it called a pandemic? So when a disease is called a pandemic, it means it spread the world over, and in this case, even Uganda is inclusive. It has been affected by COVID. Thank you. So one thing that is very important when we talk about COVID, we need to understand these phases because it had important implications on livelihoods. the various phases. So let's start just with phase one. So phase one, from the time when schools were closed, I remember that was on 20th, and then until the time when the lockdown was declared, the focus was on prevention. So it was difficult, and that's when we saw a lot of things start to change, especially in terms of refugee livelihoods. Many who are going about their daily business, I think things came to a halt somehow. So that was the first phase of COVID. And then was about delaying. The first was focused on prevention. The second phase of it was more of delay. These are my kind of timelines. They are overlapping, but this is my kind of, yeah. So with the delay, it means now from the period May to June, there were a lot of things that happened there. And we saw that, for example, there was already COVID in the country, and the numbers were rising, and then it also posed new challenges, and that had important ramifications. So, but the good thing, at least, there was a better understanding of COVID, not like at the stage where the emphasis was on prevention. Everybody was confused. Nobody didn't have the accurate information, or they are not very clear, or there are a lot of changes still taking place. So in this phase, at least, something was known and people knew how to prevent it, but still now cases were increasing. So what was the focus? To make sure that, yes, we try to delay it as much as possible from overwhelming the health facilities. So that was also important, but it also had implications on livelihoods. Remember, when there was the lockdown, almost all economic activities came to a halt, except the critical ones. Now, at this stage, certain things started to move, but it was still with some difficulties. SOPs had to be put in place, but at least there was a bit of relief. Then let's move to the phase 3, which was more of managing. So in this stage, there was the first COVID death already in July. We had the highest number of cases of COVID, around 398. So again, this one now, we realized COVID is there to stay. We, yes, tried to prevent it, but when we could not totally prevent it, then the infections were rising, and then now COVID is a reality. We have to live with it. So we began to see at least there was some bit of opening. We saw some sectors, transport, people were moving. So at least some kind of economic life started coming back. Yeah. So what were the key observations? So these are what I saw, but I also tried to back it up with what other findings by other researchers were. So about 87% of refugees, according to them, that say that the pandemic had negative impact on their livelihoods. About 50% said they had lost 75% of their income due to lockdowns. You had refugee families headed by women, elderly, and the person with disabilities who were really hit hard. Market food prices in Kampala increased by 3% in the first week of the lockdown. And then, of course, we also had policy gaps. You know, there was a lot of restrictions on movement, and urban refugees were, for example, presumed to be self-reliant. I think Godfrey can bear witness, but COVID exposed this, that, yeah, we need to understand that's the reality. The urban refugees, not all of them are self-reliant. So the source is the WFP survey. And then also urban refugees were caught between an overstretched government support and an overwhelmed humanitarian support. So they are caught between a rock and a hard place. You know, you are trying to approach government for food. You know, they cannot support everyone, including the refugees. And then also the humanitarian agencies, I remember so many were closed. I remember in March when the lockdown was declared, many agencies, actually the staffs were remained at home. It was really a very difficult time. And those who bear witness, I think at GRS you saw what was happening. It was really very difficult, but we had to engage with the local authorities, with the RCC, with the police, and so on, so that we could find a way of supporting these people. It was a very challenging time. Thank you. So, before we can understand livelihoods well, there are certain important data aspects that we need to look at. What is the population we are talking about? So right now, the population of urban refugees in Kampala is about 81,412. That's about 5% of the refugee population in Uganda. And then the average number of households, the average number of members in the refugee households, so that's about 5. And then, yeah, cell phones are very important, by the way. I'm bringing about some of these things. You know, like if we are talking about transactions and accessing certain services, phones have become very important. For example, now the WFP cash disbursements. So if you don't have a phone, then it's more challenging to get this support in time. Identification cards for the refugees, very important. Some people couldn't access certain services because they didn't have identification cards. We talked about those who just came in afterwards. It was really difficult for them to access services. I remember I was struggling with the police. At some point, you know, they say, what do we have to do with this person? And the person has completely no documentation. It was really, really tough. Yeah, and then education also. Education influences people's abilities to adapt. So that is one reason why it's also important. There are certain kinds of livelihoods. When you have education, the higher it is, the better. For example, skills trainings. Yeah. So if you have not any education, it's a bit more challenging, yeah, even to access. Gilbert. Yeah, so now I'm going to focus on 2 aspects of livelihoods for the refugees. I'm focusing on employment and income. That is very important because remember I said from the simple definition, if a refugee is able to put food on the table and get other basic necessities, it goes back to these 2 functions, employment and income. Now you can see that most of the refugees, 57% are self-employed in the informal sector. And then you have about 18% who do these casual jobs for a short period of time, 1 week, 2 weeks, 1 month. And then you have regular employment, you have only about 7%. So that shows where we are when it comes to income. So on average, when you look at the income types, you'll see that self-employment on average brings about 150,000 per month. What can 150,000 do per month in Kampala? It's very challenging. And then you look at casual employment, there are people, refugees earning as low as 45,000. They have families to feed. So how else do they support their families if they are not engaging in something else which is fishy? Yeah. And then we found out also that those who are in regular employment, who are about 7%, earn up to about 380,000 on average. Okay, this is fairly okay, but still, I think to meet the basic necessities of life, it's a problem. And then I've factored in non-employment income. That means these refugees who earn, for example, 150,000, 380, depend on other sources. So when we talk of non-employment income, there are some who receive remittances, there are some who are supported by friends and family members, so that is very important. So there are some who get up to 490,000 if you value that kind of assistance. Yeah. And then remittances are really, on average about 180,000. So this is the non-employment income. So what has been the impact? I think our colleagues, Jolie and they've talked a lot. They are living examples of the true situation of the refugees. So coming back to refugee livelihoods, you can see that markets were significantly disrupted. The supply and production chains, everything was affected. So this, you can look at it later. There was this quote from one of the refugee women who was saying business was good at the start of the year. This was a Congolese refugee and who makes and sells handbags in Uganda's capital. Her customers were the daily commuters, now absent from the once bustling markets, shut down following government lockdown. So this is what happened. So they lost markets. So the market structures were not working as it should. Unemployment situation worsened. So either they were underemployed or there was nothing for them to do. That brought about a decline in wages. Okay? Yeah. So a significant number lost the jobs they were doing. Yeah, so and then connected to that, you see that the loss of income revenues caused financial instability, okay? Yeah, because the urban poor have little or no savings, and this constitutes the refugees. They don't have any savings, so it was really, really difficult. And then many got into debts. They were borrowing to support their families like you had. And then the most vulnerable were neglected to fend for themselves, widows, elderlies, persons with disability. So the policy of assisting only refugees in the rural settlements is something that needs to be rethought. And then you see that also there's economic hardships that led to violence, especially SGBV. I think Mary can bear witness, or all of us who are here. SGBV really shot up. So, and it's because the traditional roles of men as breadwinners was interfered with. So women took over, and sometimes men were provoked by that. Yeah, and then dependency on humanitarian agencies, that is something that became very vivid. And then also the livelihood situations deteriorated. Remittances from abroad fell, you know, because Australia, Europe, Americas were more or less affected in the same way. Women were more affected than the men, because women, first of all, earn 50% less than the men in most cases. That was a study by Financial Sector Deepening, Uganda and Ministry of Finance, 2020. Okay, that's in pictures, because there's a Chinese saying that a picture speaks 1,000 words. So you can see women being beaten, and I guess many refugee women trying to support their families face the same thing. Move. Yeah, so many were dependent on humanitarian agencies for assistance. Yeah, so these are some of the humanitarian agency responses during this COVID-19 period. So you can see that was one of the partners, and you can see how they are trying to support the refugees. It was really challenging, but at least they tried to do the best within their means. Yeah, continue. Yeah, so how were the refugees coping? So they've talked about a lot of things, our brothers and sisters. So one thing is they were dependent on humanitarian agencies, and then some also gave like grants to support refugee businesses. Some of the refugees did not just sit. They were not completely helpless. They tried to do everything they could do to support themselves. I think the refugees should be commended for this, especially the urban. It was difficult, but they could not die hungry. They fought the good fight. And then, yeah, and then also we saw there was a lot of dependence on social networks. And for me, I think this is something that the partners can work on to strengthen. If we can do a lot more, I think in future it can help us to prepare better. And then also we saw something on the negative. There was adoption of economic coping strategies that put the refugees at risk. Some were involved in sex work, because you're earning 150,000. How do you survive? There must be a way you are paying this rent, you're buying food, you're transporting yourself. So some were involved in those kind of activities, sex work, illegal hawking. My brother Jolly Salongo talked about it, vending, and some ended in prison. Others who are like with disabilities who are involved in begging. You'd find them, you know, seated somewhere and begging. So this became the norm of life. So what are the challenges to resilience building and self-reliance for urban refugees? One, the issue of the policy framework. This is something we need to rethink. Oh yes, Uganda's policy is very progressive. It allows freedom of movement, work, and so on. But in reality, when you go on the ground, there are many things that need to be dealt with. I think the self-reliance strategy that we have has not produced much in terms of tangible results. So if you look at, this was the findings, by FAO and OPM in 28 that 80% of refugees in Uganda still live below the poverty line. I don't mean to say Ugandans are not, but this already shows you that we need to rethink our self-reliance strategies. There's also inadequate understanding of our local markets and businesses, and demands continues to fail urban refugee livelihoods. There are a lot of initiatives being undertaken by the agencies, but I think the agencies are still not well equipped, even those involved in the livelihoods. There's a lot more to do to understand these markets and help them to work. And then also it's very complex, the nature and structure of these urban markets, so there is need for the specialists to find a way to navigate around it, to find something that actually works for the people. For example, we need to look at the barriers to the markets like language, culture, and social capital. These are very important. Then there's also limited local and indigenous socioeconomic networks that keep refugees on the fringes of the labor market. So social networks in urban areas are actually very important. They play a very critical role. What were the opportunities? COVID was not entirely negative. It came with some opportunities that the refugees, some tried to tap into. One was, for example, increased opportunities for mass production for refugee tailors. So at JRS, for example, so many were engaged in producing masks and they were paid for it. Another thing that was very good, UNHCR came in and we tried to engage with them. Instead of importing masks, at least we had local production of the refugees. This was commendable, And then also we saw adaptation of technology and digital skills for business and work purposes, so this was very important. Easing of restrictions also allowed the economy to open, and refugees could also tap in. And then in the real economy, there are also opportunities in food, health, and manufacturing. This is something we could go into. So that's in pictures. Sustainability, very important. So when we talk of sustainability, there are two things. Are we talking of sustainability of effect or of effort? We need to understand what this means. When we talk about effort, it's more to continue doing the same thing. But effect, if we empower the refugees, is something they can go with to their home countries, like the skills they acquire. And then two, refugee-to-refugee approach. For example, at JRS, one thing that we decided to do is refugees who have acquired vocational skills, we have helped them, like when they start their businesses, sometimes they take on interns and we pay them for that. So this, in one way, is helping refugees support other refugees. Very important. And then vocational skills training, these skills they can go on to their home countries, and then partnerships with agencies involved in livelihoods for eventual handover if JRS exits. So recommendations. It's about the policy. Again, we need to work on that. And then programs to stimulate refugee, micro and small businesses, inclusion of refugees in social protection, responses, for example, unemployment benefits like the food some refugees got, very important. And then decision making is even more important if we involve the refugees. Then adapting technology to humanitarian livelihoods activities. Thank you. And then diversification of urban refugee livelihoods and engagement with the private sector. So thank you very much for listening.
Thank you so much. A big round of applause for our presenter. Thank you, Mr. Geoffrey. And I thank you, JRS, for standing with refugees. Without wasting much time, I'm going to give an opportunity to the plenary. I'm going to give you if you could raise just 5 questions so that they're answered quickly and we close the session. We are way behind time. Yes, just 5 questions. And brief to the point kindly. We are going to use just 10 minutes to round up and then we shall go for another activity.
Thank you so much, panelists, once again. And mine are not questions, more as to add and emphasize a few things that I thought could be important for this conference as well. One of the key things I think we need to applaud the government of Uganda has been the coordination for urban programming. I think if there is anything that stressed most of the humanitarian workers in Kampala was frequent meetings, Zoom, whether at home, whether few were in office, to coordinate and understand what support is available, who has it, who is in action. And I think that has worked so much to enhance what is actually being done. I think that brought an idea that if you're not there, look for a colleague who can actually provide a service. And trust me, even when Refugee Law Project was under total lockdown, I feel like JRS, IRC who remained available were able to continue providing services. But on the same point, to you, OPM, I think we would like to see more of this coordination come through the other arm of government, KCCA. I think it's still looking like an independent sort of coordination of activities, and yet an important factor like livelihoods remains a key thing that KCCA law enforcement officers grapple with every day, which it should have been an opportunity for refugees to build a resilience from. Just wanted to further enhance on the sensitization that the officer from OPM emphasized. I think if we combined arms together with the local structures, this information would enable the temporary solutions that are actually more sustainable in the phase of this COVID. I would talk about what he referred to as referral back to their homes, or should be homes. The few cases you manage, out of 10, 2 will actually acknowledge and realize the importance of going to the settlement where the services are a bit available to support their daily life. But this, I think the urban refugees have not yet come to live with it, and yet it is the test of their resilience, and yet this could be a far more reaching opportunity for us all to work within. Just last one more. And
One
then,
second.
Yeah, sure. Lastly, I just wanted to re-echo about the educational challenges. Just a day before yesterday, I was interacting with one of the refugees, and he told me he's a fourth-year student at one of the universities, but he's lacking tuition for the last 2 semesters to complete his course in law. What an impact would be if we gathered resources to support such kind of individuals that are actually is the main reason why they are staying in urban, most of them or majority of them. Thank you so much.
Thank you, thank you. Okay, we can take, I'm seeing 3 hands, so I'm hoping those are the only, okay, 4, and that is it.
Thank you so much. I have 3 concerns, probably just to flag out the discussion. To my friend Godfrey Byaruhanga, in view of the fact that the urban refugee policy was adopted in 2009, a decade down the road, you have given us a presentation of the crippling challenges. I just want to know from your hands-on experience, what is this one thing which we cannot afford to insert in an urban refugee policy, aware of the fact that pandemic times might be our new normal moving into this 21st century. Today is COVID. I'm sure 20 years down the road, we might have something else as a pandemic again. What is the one thing which we need to insert in this policy? to my friend Geoffrey Anen, it seems to me that financial inclusion is one idea which came very strongly from your recommendation. How should we go about financial inclusion in this highly capitalized economy of e-banking for refugees? And to the two dearest speakers, Jean-Pierre and Mama Jolie, I wanted to know from you, if you please, what is this one of the three durable solutions? What do you think is the most intelligible or sense-making solution in view of the pandemic from the experience you went through? Thank you.
Yes, thank you very much. Yes, next to him. 1 minute, please.
Thank you very much. I'm looking at the theme of securing the future management of refugees versus sustainability of Uganda's response mode. How best do we sustain the mode of Ugandans that open border service things, so that we see in the future arrangement of the refugee sustainability and management, we also look at how best we can have that sustainability spirit. I look at it through the arrangement of the oppressed, the sustained, the stretched resources, which would grow so that we can have it done. Lastly, I look at the intervention, especially as we prepare the future management on the primary causes of this forced migration. Because at times when some people's causes are not addressed, we end up only planning for the end result. I pray that in the future arrangement of the management of the refugees, we also look at the stretch of the resources, the sustainability of the hostility of Ugandans, and lastly, the causes of the refugees, the forced migration. Thank you.
Hi again. First, I want to thank my fellow refugee. It was very articulate and to the point. I am so jealous of your articulacy, on point, everything. Thank you. I would like to please beg OPM, please don't be in denial. Don't be like, level with us, be straight with us. For example, you were, it's not easy to go back to settlements like you said. It's that we have problems and he has raised them. Don't be in denial, don't tell us, if you tell us we can't do this, we can't help you with this, that is a big help, that's a big solution. But if you just give us hope, we can do this for you. For example, you said if you go to the settlement, this type of assistance will be done for you, this type of assistance will be done for you. That is not the fact. That it is maybe 30% of the truth. So please level with us. Just admit where there are problems. Yes, we have problems with this. We have problems with this. You can't just, I hope I'm being respectful. I mean it in the most respectful sense. But most times we see you like this and what you say is great. And then we go to the office, we encounter the problems. We have to go from one office to another office to another office. If you are sitting here like this and you're telling me the problems, we can't talk. You said bring us your ideas. We always bring you our ideas. We bring you refugee after refugee with problems. Those are things that you could be building on. My brother said the self-reliance strategy is not working. So just rethink. So that's what I'm trying to say. Don't be in denial. Just if you level with us, we can take it. I can't help you is a big help. Giving false hope and then taking it away is some of the problems. I want to agree with my sister, my fellow refugee. Mary, you're amazing. You're great to us. It's not always food, water that you need. And one talk with Mary can, even if she can't help you in any way, you just leave smiling, because she will give you an idea, or she will just get you thinking, get you out of your self-pity, get you out of saying, I'm like this, being stressed. She will show you a way. Why don't you do like this? How about this? So Mary, from the bottom of my heart, and also my fellow refugees who say the same thing to me, you are our hero. Thank you so much. I hope I didn't take too long.
Yes,
Thanks.
thank you. Yeah, I think that is really honest. Thank you so much. And OPM has taken it in good faith. I hope they'll be able to answer you perfectly. It reminds me of the saying, "Don't give me the fish, show me how to fish." You know, and I think that's what Mary does sometimes. She can be able to explain to you, you know what, how about this idea? And I think that is really, really great. Yes, and one last. Someone was before. Okay, you can. This Apollo, he was first. He can give his question and then she can round it up.
Yeah, thank you so much. I want to appreciate the panelists for the submissions. As districts hosting refugees, we have moved a long way to achieve the interventions in regard to refugee hosting districts. And we have got a lot of resistance and attacks from the districts that don't host refugees, but have refugees. Government has failed to define the word urban refugees. Most of the engagements we are always in, Gulu has always been on the top complaining. Kampala has also been on the top complaining. Those were two. But if you see now the number of the cities that have been created now, they will all need to be put on board. We have had the Dr. Deep interventions and these other refugee interventions, but all the districts that are neighboring refugee hosting districts are always bitter with us. I will buy the recommendation of Crawford and et al., who says refugees must return to the rural settlements to benefit, or to benefit on the support always given to refugees. Members, I will give you an example of Chiriandongo.
30 seconds, sir.
Yes.
We are.
Because I'm seeing my sisters and brothers getting worried that as if there is no life if they leave these urban areas. You come to Kiandongo, especially in Voyali, most of the booming wholesale shops are for refugees. Go to Voyale market. 30% of refugees have lockups, are doing very well. Take a study on most of the private schools in Chiriandongo. 60% are refugee students paying school fees. So don't look at Kampala as the only way of survival. We have booming businesses in Mbarara, in Hoima, in Chiriandongo, in Arua. Work next to your home station. There is a better life. Because they talked of the rural-urban migration. We have Ugandans who are here eating nothing. Tomorrow they hear that these people are getting support. My God, it will be dangerous.
Thank you.
Thank you.
Thank you, sir. Finally, there was one behind. And as our panelists get ready to answer those few questions, I'm just giving each of you 2 minutes to answer those questions, and we round it up.
I'm much grateful to all the previous speakers. My concern would be on the issue of sexual and gender-based violence, because as police during the COVID period, we've been able to receive increased cases of violence in the communities. But now when it comes to especially the issue of refugees in their settlements, my concern would be to, again, the Office of OPM. As government, are there any specific strategies and mechanisms put into place on us to see how best we are going to help with sexual and gender-based violence in these communities, especially now where we see so many teenage pregnancies among the girl children? How have we been of help? Thank you.
Yes, thank you so much, Officer. As we are taking the, as you are answering those questions, I'm going to request you answer the questions as you are giving your final remarks, so that we conclude it at once.
Thank you so much. I think I have a cocktail of issues raised against the Office of the Prime Minister. I have a team in the House. Most probably, if they have one or two issues, in case you have minutes, if minutes are not there, then we have another day tomorrow. I think we can take home and we respond so that we can respect the program of the day. But we want to exhaust all these issues, if possible, by the end of the conference. And where we are not able, we can also consult and we give appropriate answers. I want to start on a very good note from Chairperson LC5 Kiliandongo. Thank you so much. Comrades, government may not work the way we think that things will be straight if we take this direction. There are checks and balances. You have to look at both sides of the coin. This issue of service provision in urban, it has been put on a weighing machine very many years and very many times. And the results have been, and most of you have been actually part of this. What do you do? If every refugee decided to leave the settlement now, because you have opened the Pandora of giving services in Kampala, and you have 1.43 population coming to the city, what will you do? Yet you have gazetted places where you think these services are given and issues to do with security are controlled. But here, if the number increase, for example, security. But you gave a very good example of people moving. If the law allows us to move to any town, work and go back home, what's wrong with that? And it leads me into what my sister is submitting, that OPM don't live in denial. I take it in good faith. I have been a humanitarian worker for all my life, and I know what all this means, my dear. But the parent, who is a very good parent, is that parent who tells his children the truth and only the truth. A bad parent will always hide this truth. Where we have weaknesses in management and administration, it is understandable, really. And our staff are not made in heaven. They are also human beings. I want to take something home, that please, if we come to offices, instead of moving from one office to the other, really that's something we can polish. And we can have a number of meetings, engaging our staff, so that we see how we can improve. But on issues of telling you the truth, that this is the right direction, it's part of our work. As government, that please, you have come, this is the direction to take, this is the guidance we can give you. That guidance may not be in your favor. But again, we have to tell you, we have no shortcut, we have no choice. But issues to do with improving in terms of management, really, I take them in good faith, and we can always work on that and improve. All this is not for OPM, it's for all of us. Our duty, by the way, by all standards, is to coordinate the program. Service provision is supposed to be by these colleagues you see around, my sister. They came to support government of Uganda. And now they shouldn't be seen as if it is all about government. Once we are into this together. We must achieve together. If we fail together. We shouldn't celebrate achievements Then when it comes to gaps, then it is only OPM. No. The new approach you have brought on board is that now we have you under REF. I think you have seen your leaders coming through to pick issues from you. The Refugee Engagement Forum. That's now a platform we have put that actually, in case we have a problem here, let us have now our refugees into our planning. And I think it will help us. We shall keep on getting these issues. Improvement, we shall do, and I promise. Because every day is a learning day. But issues of denial, we are not in denial, but we are telling you the truth as your parents to say, please, our children, this is the direction to take. When you take this direction, you will be okay. If you don't take it, then you may get issues. If you have failed Kampala, and we are telling you there is land in Kiriandongo, there is a plot, there is a school, there is a hospital, then listen to your parent and say, okay, for now, let me go to Kiriandongo and test the waters. In doing that, we shall achieve together. The other issue of the lady who delivered was the blood documentation, needs to go to Nakivale. Can you transport that refugee and back? You see, that's where we go wrong. Because you see, when you set a precedence, then every person will parade himself tomorrow and say, give me a vehicle, I am going to Nakivale, and you bring me back. The guidance is case by case. That is a special case from the look of things, presented to community services, UNHCR and OPM, and our partner, they will see it. If that case needs to be transported and back, but we cannot set a precedent and say, whoever wants to register in Achivale, the vehicles are ready, we take you, we bring. In management, that's a disaster. You are creating a situation you will never solve. So I want us to reason out things from a very clear point of view. Otherwise, if we keep you promising you, no, that's okay, it's protection, and then at the end of the day, we don't deliver. So that's a case, a special case, and I think Peggy and the team, they can take it up. If it necessitates to be transported and back, there's no problem, case by case. The last issue, I will end with the issue of my teacher, and he wants one word. I'm still thinking of the word. But I think the issue of SGBV, I want to request Peggy that we have to have Uganda Police, I think the relevant office on the technical working group, because all these issues are discussed in the technical working group. So get in touch with Afande to know who has been representing police so that she can get relevant reports. I know that they have been contacted. Most probably they are not getting reports about SGBV. There was one person online, I think I've got it from the Secretariat, to be Aruhanga Godfrey. Why is naturalization difficult, yet resettlement is an opportunity? Yet resettlement opportunity is as narrow as passing through the eye of a needle. And this is a very sensitive question about naturalization as one of the durable solutions. We all know the issues to do with naturalization, and I think our constitution at some point was a bit silent. We had to go for interpretation of the law. We are still struggling with people to interpret, and the Refugee Law Project would be in position actually to answer this. We've been battling this thing with you, and at an opportune time, please tell people how far we've gone. But for us, even if you have spent 20 years, 30 years, actually local integration is okay, but the issue of naturalization, we still have a few gaps here and there, but we are working towards achieving that. I think we had made steps. And lastly, to my teacher, the one I loved most, and the one who supervised me, and I think produced a very good thesis, I want to get one word. Because you asked, what is that one thing that is missing in this urban refugee policy for it to work? The only word I have, sir, with your wisdom, which we shared, is sustainability. I thank you. Remarks, closing remarks. I think the discussion summarizes the remarks. And if we are still together, of course, for another day, we can engage each other. But I want to thank you for coming out with these issues. They help us to improve as government. And we cannot be on defensive, The commandants are here, and I know they are taking note of every other issue that is being discussed. On the side of partnership, that's the way to go. Agure asked the question, we should be asking you as our partner. If that student needed support, and you can support as a partner, go on. We are in this marriage together, and we are not prepared for divorce. That's my concluding remarks. We are in this marriage together, and we are not ready for any divorce. We must move together as one couple. Refugees, partners, and government. I thank you.
Till death do us part. In 2 minutes, sir.
Okay, thank you very much. I would like to respond to the question my colleague asked. I don't remember his name. So he was saying that is financial inclusion the one way through which refugee self-reliance could be promoted? Yes, I would say that is one among other ways. So one thing that we have to know is that refugees do not want actually to be dependent on aid agencies for their basic necessities of life. Refugees want to work. They want to earn their own income. They want to engage in income-generating activities. So financial inclusion is one of the ways. And I think we have already shown the lead in trying to engage with various sectors, financial sector deepening, to ensure that refugees are financially included. Before, refugees were seen like people who are not credit-worthy. They are not able to repay. If they take, for example, loans, they don't have a permanent place of abode, so they don't qualify. You know, there were a lot of all these issues. But I can see that tremendous progress has been made, and we need to sustain the momentum. Thank you.
Yes, thank you, sir.
Thank you. One question was asked, according to the situation now with the pandemic, which of the three durable solutions can fit? I don't know if 2 minutes are enough, but I can use 1 minute to explain this, I think. With the three, I'll say the first is the best, which is voluntary repatriation, because I started from a certain area, and I am able to fit in that community better than elsewhere. Living there was not by choice, it's that I was forced. But if it was possible, then going back was better. But the second one is to be locally integrated. Becoming a Ugandan is the second, because I think it is not very easy to differentiate me from him. You'll think I'm his brother until when we introduce ourselves. So it's easy to integrate in Uganda than to integrate in UK. When you see me with Dr. Chris, you see we are really different. And yeah, the skin color is different, and I'll be seen to be from somewhere else, like I've migrated. So locally integrated is actually easier than resettlement. But is it possible in the case of Uganda? Are we sure with the future? Do we know what it will unfold tomorrow with uncertainties around us, with conflicts everywhere arising from a corner to another? We are not sure, and that's why we always focus and we always pray to get resettlement, which is very difficult to get. And I think as Moril Jurami will be there, when she talks about resettlement, you'll understand that it is for those ones who cannot fit in the two. So it's not our choice, resettlement, but it's the best, because it gives us first identity. You stop being a refugee forever. You become someone. You become a national, and then your children have something. You have an opportunity to work, and then you can sustain yourself. That's why we choose resettlement to be the best. But the best in everything was to be voluntarily repatriated. Now, then looking at the case, as he has answered Mr. Geoffrey about the case, I really appreciate. Thank you very much.
Thank you, thank you. Yes.
Thank you,
2
my
minutes.
brother. But I said, depend on what you are saying. It's not easy for everyone, because everyone comes differently and has their issues. That is what I can say. Now, come back to the question my brother says. I think what I can say about that is to join our hands with our partners with our government, Uganda, and give refugees advice what they can do and how you can increase their opportunities to work in Uganda. As before COVID-19, I can say the life it was continuous and it was increased in refugees because we have opportunity to move around, to look the money and other things we are living. Now I see the advice is more important to refugees and our organization to join the hands and head to see how they can get opportunities for refugees. Thank you.
Thank you so much. Thank you so much. A big round of applause for our panelists. I think they've ably brought out all the points that we needed to hear. Thank you so much, our audience. You've been a very good audience. And at this point, I won't say much because we're really time bad, although we started a bit late, 30 minutes into time. However, I hand you back to our moderator.
As our panelists and session chair take their seat, please let's give them a round of applause. Thank you very, very much for your session and for the great deliberation. It's also quite amazing to hear from those who have gone through these experiences, share with us, and always brings a different feel to the room than normally when we have technocrats or stakeholders discussing these issues without them being in the room. And also to thank you very, very much for being patient up to this time. We are coming to the last item of today, and I will request His Royal Highness Chief Drani, the Paramount Chief of the Mahdi, to come and give us the closing remarks. The Mahdi are host to so many refugees both in Moya and Adjumani, and he culturally leads the Mahdi.
Good evening. Oh, good afternoon. It's not evening yet. Bless you guys. Yeah, it's great to be with you guys here. It's been a rather long day for a Monday. Some of us are still getting over the weekend. You find yourself having had a great, huge lunch and into an afternoon of a lot of very important and necessary talk and a lot of clarifications. First of all, I want to thank everybody in the house for your long suffering and your patience all day today. It's coming again tomorrow. Hopefully you'll sleep early this time and you can get here earlier than I did today. I want to thank the Netherlands people and their embassy for always and ever being present when needed the most, and for being a great part of this discussion today. I'd like to appreciate so much the Refugee Law Project under the guidance of, I'd like to say His Excellency, but you're not allowed to because you're not that excellent apparently, but I think you're more excellent than that. Under the guidance of Dr. Chris Dolan, most capable, and we thank you for all the work you're doing. And we thank you guys for choosing Uganda for your operational base. I believe that the work you've done here over the years has gone a long way into uprooting the unnecessary seeds or seedlings that we seem to sow amongst ourselves and we grow up with and get entangled with in future that don't enable us to stretch our hands or our minds to think rightly or correctly. So we thank the work of Refugee Law Project and appreciate them so much, because the work they do is not just in what you see here. It's not just in helping refugees. They do a lot of things in government. They help the police, the army, not just in theorizing or changing minds in theory or in conferences, on workshops, but in actuality. There's a brand new police station built in Lamo, where there's not been a police station before. You understand? There's so much they do. There's logistical support. There's help for refugees. There's treatment. There's so many different things. This is just a small organization. How much more would they do if they were a big organization? So much more. So we thank the Netherlands Embassy for your continued support to the Refugee Law Project. And we also thank you, the GDF, for for your great support too, which is most appreciated. You see, today's subject matter is one, but it's been cut into two. The subject matter is the future of refugee management in the Great Lakes region. This is the region we are living in. The most used to be, I would like to say used to be, because we have to come out of that entanglement. I think we have learned a lot from Refugee Law Project in the years. And so they used to be the most war susceptible to war area in Africa. You understand? It's the future of refugee management in the Great Lakes region. But can we change that to the future of conflict management in the Great Lakes region? Why do I say, can we move from the word refugee to conflict management, as in looking at this conflict in the actuality that they are in? What is that actuality? There's the actuality of number one of the African Union. That is where we exist. It does not look at Djibouti, Somalia. It does not look at Uganda, South Sudan. It does not look at Congo, Burundi, Rwanda, Tanzania, Kenya. Can we start to think as an African Union first? So that we can say the management of conflict on our continent, rather than cut the sub-regions into what they exist as at the moment, Francophono and Anglophono countries, or a few Portuguese countries. What is the African vision in our conflict context? Many years ago when Chris first came here, he came into Uganda that was filled with LRA. Alice Lakwena LRA and now post-LRA. But did Joseph Kony ever have guns, money to buy guns? Did Joseph Kony ever have patents to make guns? Where did he get the guns he used? Now, I ask you, if he got these things from abroad, whose interest was he fighting? You understand? You might fight a war to become a president, and yet tomorrow you won't know that when you become a president, you become someone to sign checks or to implement the wishes of the other people. Your donors, your funders. AK-47s, Kalashnikov. I say African kills 47 people before they die. Every African that's got an AK in their hands will kill at least 47 people before they die. I don't know why. It's a crazy, crazy weaponry. It's not made in Africa. And yet we spend a lot of our time investing in these things. We invest our children's future in these things, in our grandchildren's future in these things. How? It is not that we are fighting for their futures, but we sign away deals of the future which would have paid for their education, their health, and their systems. And we sign them away for us to get a few guns to use right now. And these are guns which they don't use there because they're expired or expendable guns. It's like you're getting muskets in a time of Gatling guns. The issue I'm trying to say to you here, Africans, not Ugandans, we are living in a time of African integration. African integration. When are we going to come out of the time as the people of Netherlands did, as the people of Germany did, as the French did, as the British, the Irish, the English, and the Scots, and the Gaelics, as they did, and wake up to a modern modernity where we play our role in identifying human needs and trying to help to fix those areas, to plug them areas, with a leadership that will care for the people and not care about the figures in bank accounts. When are we going to wake up to these times? First of all, before COVID, we were stuck in a time of terrorism. Terror here, terror there. Syria, where? Libya, Yemen, Kenya, Nigeria, Somalia, Uganda. Everywhere it was terrorism. They were talking about Congo, they were also there. They were everywhere, terrorism. And then came the locusts. After terrorism, these natural disasters unfolded. And then came COVID-19. And now there's floods devastating the north. But the floods came before COVID-19 because they were planned for their season. Because in the rainy season. This is a time when Egypt and Sudan and Ethiopia and Uganda would have been drawn in a Nile conflict. Over what? And now they are complaining they have too much water. They don't know where to put it. Cities are drowning, are flooding. Khartoum. Now, you said Uganda was cutting off the water. There is the water. Put it somewhere. You want to war? There is the water. Why do you say it's Uganda? That means even when the dams are created, the same water will be flowing. It's not Uganda. It's a natural effect, natural phenomenon. And then in northern Uganda, we suffered and we're still suffering with logging. You remember Mapenduzi caning people? Do they listen? No. Even in COVID, still logging. We're struggling with giving people lands, trying to demarcate lands for people and stuff like this. These people are logging the lands, causing confusion amongst us. Before all this COVID, they cut the rations of the refugees from so many kilos to so many kilos. More than half, about half, was cut off. This we are talking about a humanitarian response. OPM, you're here. You commandants, you're here. Biaruhanga might have left, but you're here. Who makes these recommendations? How do you cut off someone's half the food supply? What do you expect? Are you chasing them back to the country? Voluntary compliance? Like, I don't know. We're trying to integrate as Africa and deal with the problems, not exacerbate them. And this food we are talking about, why is it that in this day and age, it's still foreign governments who work so hard and are taxpayers that pay for the food for refugees in our countries, when we're a very fertile country? We go for them, we ask for things for planting, helping our refugees. Instead, we buy hose, handheld hose, when there's sufficient money to buy tractors and build silos. Instead of silos, what do? You build some funny rudimentary things that don't work in this day and age and in this population. When are Africans going to get up and wake up from this slumber? Is it the word Africa that is a curse? When are you people of the Nile basins, of the sub-Saharas, of the northern Saharas, when are you going to wake up? How many years do you have to be tribulated, pursued, chased through deserts, die in oceans, crossing Mediterranean Sea and all these other things before you wake up to a reality? I'd rather make a weave of 50,000, 70, 100,000 than go and see people, refugees. Then look, can we say that some funds come specifically for refugees, and these funds are spent specifically on refugees, but we have to register people are not refugees? Because this is the only way people are going to get services. Why is it that refugees today have exposed our countries that the meager resources refugees are getting, even nationals don't get? And it has exposed the rot and the graft in our systems. The meager, inferior, that refugees get, even that nationals don't get. Do you know that? I'm talking here, as Jumani, we were the first people to give land for refugees hosting. Changwali would never have been enough for all you people. There are more than 1 million South Sudanese, let alone people from Burundi, Congo, Rwanda, everywhere. It would never have been enough. That is the government land. Our land is in Madisab region. That is part of our Pan-African contribution, so that our African brothers can be alive and live a dignified life. There will be a small place, pull out for you to dig, to start making a life of yourself. And then you can live from there, travel to the cities, and then back. Cities and back. This is what Biaruhanga was saying. You have to have a place that they can identify as your home. In our evolution as Uganda, I'm sorry, that's where we still are. Until the policies are changed. Until Africans stop bombing each other. Until we stop wronging each other. That is where we are. Because at least there we can identify you and say this person came from that settlement. If you're caught up in a bomb blast somewhere, we can take you back to that settlement. Now you die in Kampala here in Chivubo, where will they? they'll scoop you up and just dispose of you anywhere. The impact of COVID. On the refugees. A lot has been said about refugees, but on the host communities. You understand? You've heard a lot about refugees. Let me talk about host communities now, since we are one of the first host communities here. We gave our land, by the way, without a single cent. We have never been paid for the acreage of land, not for rent, not a day, not even this steering bill, Lugabire, Nani, per chief, per elder, per whatever. We have never been paid. That one is a district councillor. He can ascertain to that. If you've been paid, have you been paid anything? Yes or no? No. Since 2013, we give our land for free. And our land is not for taking. As you have tried to wrangle around and stuff like that, try and take our land, OPM, and these other people. Our land was given to you for the refugees to use. When they finish using it, they go back home. When they go back home, we get back our land. It's our Pan-African contribution. It is not for sale or anything. It is our Pan-African contribution to human society and development and protection. The impact of COVID-19, the very first case of COVID-19 was registered in Adjumani. Do you remember that? First case in Uganda was in Adjumani. Not Entebbe Airport, not anywhere, in Adjumani district. We have struggled with COVID-19. That person was healed in Adjumani district. A lot of money has come in for COVID, but we've got our little share, for which we thank you for. But we continue to struggle with COVID-19. The impacts of it, even health workers have been very adversely affected by COVID-19. Plenty of health workers have fallen sick to the disease, succumbed. But they will go on treatment, get better, and continue the struggle to treat people without being paid. This is people giving of themselves. COVID-19 has affected us so much in many different ways. As you all are aware, COVID-19 locked down not just the whole of Uganda, the whole world. The global economic system was collapsed, collapsed. Uganda Airlines had just bought its new carriers before they even lifted to go to places. It was grounded. You understand? All these big airlines were grounded. Now, what do you think? Who do you think you are? This is the president said this is a struggle. It is better to eat 1 meal a day and survive to another 3 days than for you to eat a whole stomach full and die in the next 3 days. It was not a joke. COVID is a disease that started in China. It is not here. It did not originate in the UK or Netherlands. The Norwegians did not ask for it, or Austrians, or Koreans. It started in China. Perhaps we need to think about more about how to to reevaluate our use of animal products, because that's what they say COVID came from bats. And now in Denmark, I hear there's a different COVID strain that comes from mink. Mink coats. These are mink. They're like foxes or small things. They are not in Uganda. In Denmark, a COVID strain that's coming from mink. Do you understand? So COVID-19, I think we need to reevaluate how we are using animal products. We might be having conferences about COVID-19, but if we stop these animal products, eating these bats and stuff like that, maybe we will have less problems with animal disease issues. So we can concentrate on our human survival and evolution. There was economic collapse. But through all this, Uganda has done very well. You understand? Uganda, we have done very well. With or without, and with especially with our refugees, we have done very well. There was the lockdown, there was the SOPs. We did not know this disease. Is it going to come and it will wipe everybody out? So that if you can survive or what? Now we'll know a little more about it. And we shall get better. But at that time, it is not just Uganda that closed down the borders. It's every country that closed down the borders. Yes, I am coming. You understand? So please, can we bear with one another? Can we bear with our government that is learning through things? Can we continue to give of our minds like the refugee community did today on how to improve these relationships? Because I thank Refugee Law Project so much because they continue to invest and in people to share ideas for creativity and innovation. Because without these two things, you cannot make progress. You understand? So we have to continue to come together in this fora and take down the information, share with the OPM, who have to go and share with others, and share with our partners, and share with our stakeholders, and share with other governments the lessons we are learning. Because we are evolving, taking on refugees at this size and this scale is a new thing for us as well. You understand? So please bear with us. We are trying to learn. And in the middle of COVID, we are learning it. It's so-called new normal. Maybe it might finish after these new electro whatever things that happen in the Western hemisphere. But yeah, this is the new reality. We have to live it. We have to mainstream COVID-19 into our activities and listen to people and learn from people and learn lessons, because there's no COVID-19 expert. You understand? Because there's no even vaccine. Not in Europe, not in Africa. The one we created in Madagascar has failed, I think. So COVID affected us socio-culturally. But how do we bounce back and learn from the things? So COVID has affected refugees and host communities in many different ways. You know, right now, the price of testing for COVID-19 will put you out of maybe 3 months for food alone. You will cut that budget. And this is in a time of COVID where people have no money. Now, how much COVID do you think is in the community out there? Today I was reading that Uganda is in phase 4, where you don't know where the disease is, but it's there. So, Since it's in phase 4, we are all getting it. If we don't get it, then you count yourself lucky. But we are going to get it, and we are going to live with it. If you're going to complain and dance around, you're going to kick the bucket, we'll bury you nicely, and we'll get on with life, because we have no time to mourn. Because it's like the Black Death. So, pregnant mothers are getting pregnant with COVID. The unfortunate thing is young ladies, young men who are out of school are also having COVID. And we are getting COVIDized. This is the new normal. You understand? All in all, ladies and gentlemen, here standing before you is the paramount chief of Madi. I am a member, listen, I am a member of the district task force in Madi sub-region. I am a member of the district task force. Yesterday was the first time I stepped into Kampala since February. When I came back from, where did I come? From Dubai. That time, no, Abu Dhabi. It's the first time I'd stepped out of Ajumani yesterday to come here, to be here today. But I left at home a child in isolation with a mother who had tested negative, a babysitter that is negative. I, the father, am negative, but a child had tested positive. For 14 days, last 2-3 weeks, have been hell on my mind. Because this COVID situation of my own is not the only thing I have to deal with in my mind. I have land mapping that is going on. I have people who are trying to grab land. I have politicians, so-called politicians, that are selling land in my domain to supposed investors. I have different things going on, and you have to handle them at the same time. And then, the night before I came, we took the longest walk. When I came here, I was hurting in the groins and everywhere. I still got scarred, my feet, blisters on my feet from walking many miles. I got home at 10 o'clock in the night. And I had to be up in the morning with all the pain. I took to my Panadol, went to sleep. You understand? This is the reality of living with COVID. The point of the day is life does not stop because of COVID. Life goes on. We have to achieve what we can whilst we are still living. And we pursue so that we leave less to be done for those who will grow tomorrow. COVID has affected us. But our response toward COVID will determine whether we sit in the Zomba negative or we sit in the progressive in the times of COVID. So, ladies and gentlemen, I want to thank you so much for being a part of this. I'm sorry if I've strayed a bit from the subject matter and stuff. It is a very interesting question. The COVID issue, the refugee issues, our African issues, because these are Pan-African issues. And we want to thank our partners that stand with us and sit with us every day for us to come up with our own solutions so we can stop fighting and become a society such as theirs that can contribute to other people's peace in their own places when we use our hard-earned taxpayers' money. Ladies and gentlemen, I want to thank you so much for being here. I'd like to take this opportunity to adjourn this meeting till tomorrow. God bless you so much. Thank you.
As he takes his seat, let us give him a round of applause. I know that time has not been our best ally. I'm sure Chief would have said much, much more. A bit of logistic announcements. We will see Susan and Patience at the back. They request that those who are here for the 3 days, they will be seen on the last day. But those who are here for today and no tomorrow, because the invitations to limit on the number in the room, there are those who have a 1 day's invitation, 2 days invitation, and others 3 days. So those who have 3 days, please, let's see them on the last day. Thank you. And I request that we come here tomorrow early. Thank you, thank you, thank you, everyone. I think you deserve a hand clap for yourselves for staying here, spending your day. The jam this morning was crazy given the road work. So thank you very much. And enjoy a cup of tea as you leave, as you interact. Thank you.